Hello and welcome to Counting Sheep, Importance of Sleep Hygiene. My name is Manuela Rodriguez, marriage and family therapist with Community Health. We are excited to present today's topic as it is a hot topic in our community. Please make sure to visit our website, baptisthealth.net/communityhealth, to learn about other live programs that we have during the year. Why is it so important to sleep soundly? We get asked that question a lot, or when we're visiting our primary care physician or any specialist that we're working with, they ask us, how are your sleep patterns? How have you been sleeping? Or even after a long night or a sleepless night, somebody may visually see that we've had a difficult morning, right? So we've heard the benefit of a good night's sleep. And just like we prepare our bodies in the morning to start the day, whether it's with coffee, exercise, or a moment of gratitude, we should do the same as we prepare for a good night's rest. So what are some of those areas that we can improve, or tips that we can improve as we're working on our sleep hygiene? What are some practices that we might already be doing and some new techniques that can help us rest easy and rest throughout the night? So how can we be more intentional with the things that we prepare ourselves for a good night's rest? Our night routine, right? Some ideas can be a dark room. It can be closing the curtains. It can be covering some of the lights that we have throughout the room. Journaling before going to bed, getting your mind away from the electronics as best as we can. Sometimes we're attached to our electronics, which make it difficult. So it's recommended 1 to 2 hours before getting to bed that we're disconnecting from our electronics. And also another tip is maintaining the bed as a sacred space, as a space for resting. So making sure that we keep these techniques and some of these tips. And if we are working on making these changes, we are being more intentional and we continue to have difficulty sleeping, it is important to visit a specialist or mention it to your primary care physicians, right? So there might be more than just 1 or 2 nights where we're having difficulty sleeping because it's work related or something going on in our lives. But if it's consistently and frequently, then our recommendation is to make sure to speak to your primary care physician, your specialist, and let them know about those changes. And even jotting it down as you're journaling, you can be able to visually see what are the patterns in your sleep hygiene and what are some of those things that you're intentionally changing and it's still not successfully having a good night's rest. It's important to keep track of sleep because difficulty sleeping can become chronic and it can interfere with other medical conditions, right? And as I mentioned before, specialists, primary care physicians, they always ask that question, how is your sleep? Because it's so important to recharge the body, just as we recharge our phones after a full day, or when it's running out of battery, we get signals. Our body will do the same. Our body will give you the signals, but we have to learn to read them. So what are some of those messages that we get about time to recharge? And we might ignore them continuously, repeatedly, and it becomes a pattern. It becomes a habit of not sleeping and not really exploring what are my sleep hygiene? What is my sleep patterns? What are the things that I'm doing before going to bed to make it a successful good night's rest? So it's important to mention those changes journal about what are some of those areas that we've seen improvement, and making sure that we seek the support that we need. So we can speak to a friend or a colleague about what is something that can help them, but it's always important to visit the specialists that have training, that can have some additional resources and can see the entire picture, right? We want to make sure that they see all of you, not just the sleep pattern, but also if there's anything medical going on, and making sure if that there's no um, you know, coexisting disorder. So it's always important to make sure that you speak to a professional, because we know that there are a lot of diseases out there that can be influenced or can increase with the lack of rest. So cardiovascular diseases and hypertension, right? Part of that treatment plan is making sure that you get adequate rest, making sure that you give your body the right amount of time to recharge, right? So lack of sleep does not allow the body to recharge. We need to give the body a full charge so that it can work throughout the day and support you in all of your activities, whether it's physical activities, mental activities, even emotional activities are going to be influenced by the lack of your sleep. So it's important to take into account how important sleep is. And we know how common sleep disorders can be misunderstood or misinterpreted in our community as well. So some of those common sleep disorders, right? It's important that we speak to a professional and get informed, making sure that we have the right information and not diagnosing ourselves or diagnosing others for bad sleep habits or poor sleep hygiene, right? So it's important that if we're making those adjustments and we're gathering those resources and we're still having difficulty sleeping, right? It's going to be interfering with your daily living skills. Now your work, your relationships are impacted by the lack of sleep. You're unable to make proper choices, proper decisions, poor thinking skills as well, or you're less reactive or more reactive, right? Because now your daily living skills has been affected by the lack of sleep and the frequency of the lack of sleep, right? So we hear about insomnia, right? The inability to fall asleep or stay asleep. So we throw that word around like, wow, you must have insomnia, right? And we shouldn't throw it around lightly, because these are disorders that need to be diagnosed by, a professional. So it's not to diagnose each other, but say, look, I've noticed that you keep mentioning a change in your sleep pattern. Have you talked to anybody about? Are there any resources I can help you look for that can help you with your sleepless nights or difficulty falling asleep? There's also hypersomnia or excessive sleepiness, right? That can be even dangerous. That can impact your life in many ways. So it's important that we're taking note of this, but also making sure that if I see someone that's excessively sleepy, right, and is not able to function or drive properly or make decisions properly, that is going to impact not only that individual's life, but those around them. Right. So there's also sleep related breathing disorders, sleep apnea, sleep hallucinations. Um, it could also be sleep related movement disorders like grinding or clenching of your teeth. That might be something that might be identified with a dentist. And it's important that you follow up and make sure that you're seeking the professionals and the resources to help you have a smooth and sound sleep. The more we're able to recharge, the more functional we'll be in the morning. So about 70 million people experience sleep disorders each year. So it's more and more common that someone does have a sleep disorder. So it's important that we stay informed, that we have the adequate resources, and that we're supporting each other as best we can. Sleep and mental health, right? If we had, not that good of a night's rest, we might be irritable in the morning. And it's a two-way street, right? So a lot of times difficulty with sleep can impact your mental health. And people with mental health issues are more likely to have a sleep disorder. So it's not to say that one happened first and then the other, but it's also talking about the what brings these two together, right? And how important it is. Just like we check our physical well-being, we are checking with our emotional well-being, our mental health, and also our sleep patterns, and making sure that we're giving our body the right amount of time to recharge. And staying informed and having the appropriate resources are very important. We hope you will join our programs that go more into depth on some of these sleep related disorders, but also getting informed on the internet with the proper resources. So the American Academy of Sleep Medicine, as well as sleepeducation.org. Those are some resources that we're providing, as well as our Be Kind to Your Mind mental health screening at Baptist Health. This is an anonymous mental health screening that can give you some additional resources, and our community resources that are the Recovery Village at Baptist Health, Baptist Health Care on Demand, our support groups, 211 for community services, suicide and crisis lifeline, and NAMI, which is the National Alliance of Mental Illness. We are excited to provide this programming for our community. Please stay tuned and connected with our baptisthealth.net/community health for lifestyle and education programs and videos. Thank you again for joining, and we'll see you soon.